Nursing Union, Denosa, has warned that water outages in Johannesburg could lead to an outbreak of infections in patients and staff at health facilities. The Rahima Moosa Mother and Child Clinic, as well as the Helen Hospital, have been reeling from the water cuts. For more on this, we're joined by Bongani Mazibuko, Gauteng Provincial Secretary for Denosa. Very good afternoon to you. Thank you so much for your time. You are warning of a major crisis. Talk to us about it.
Good afternoon. Thanks for the time. As a nursing union, we are concerned about the continuous water shortages in Gauteng, particularly those two hospitals, which is Rahima Moosa Mother and Child and Helen. We received reports last week of some of the staff having already been exposed and experiencing gastroenteritis, which is an infection, or primarily from lack of sanitation, if one can just put it plainly. And now we are concerned that if this continues unabated and without proper intervention, this is just the tip of the iceberg. We've had previously cases of Klebsiella in some institutions in the province, and we know how some of those cases have ended with neonatal lives being lost in the process. And we are worried that it can go in that direction if this does not go corrected.
With this erratic water supply, perhaps bring us into the reality of nurses who are, who have this matter especially tough on them. What actually has to happen when there is no water in the hospital?
Unfortunately, if there is no water at the hospital, like everything else, it falls on the hands of the nurses. And the nurse is the one that must take a bucket or whatever utensil is there to be able to go and collect water so that the patients can have water to drink. Patients can have water that can be used in the bathrooms. And it's not only the nurses, also the cleaners in the ward and so forth. And doctors are not able to do procedures because in between patients you need to be washing your hands, you need to be sanitizing. Now if there's no water, it means some of the things need to be put on hold. Operations are put on standstill because they are not able to proceed. So as a result, the healthcare system in general, there is a backlog. And our members who are nurses are at the forefront of this because they are the ones who then need to explain this to the patients to say that these procedures have to be postponed or have to be cancelled because of the lack of water. And it therefore makes service delivery a hassle and a challenge, a mountain to climb, making it impossible for the nurses and doctors to do their jobs.
So you've also warned against nurses acting outside their scope of practice, saying that it's perhaps not even worth it. Definitely.
If you look at how the department has been treating nurses in the past, we've seen that they really don't care. Our members were working throughout COVID, and for the past 2 years, they did not even get an increase. And now we're at a time where government is not even willing to negotiate. They want to give them 3%. And on top of that, if anything happens to them, you'd find that an injury on duty form is not even properly completed or even completed for that matter. If a nurse is going to be fetching water and then he or she slips and falls, that's an injury on duty, but they'll be told that they were not doing their job. They were acting outside of their scope. So we're therefore saying to our members that they should be careful of doing these things which are outside of their scope, which then would lead to some of these cases. Case in point would be, we had a case a few years ago whereby a nurse was with a patient in an ambulance, and the ambulance had an accident, and the employer refused to pay that particular nurse for the injuries they sustained. So if you do anything which is not in line with your job requirements, the employer is going to give you challenges going forward. Hence, we are saying to our members they should be careful of that.
Do you think that perhaps what you're saying may be perceived in a more negative manner, in which we continue, of course, to hear of the horror stories in hospital when it comes to the dynamics between, those who have come to the hospitals to get service and assistance being ill-treated?
It's very easy when you're sitting on the outside to look at this in a negative manner. But at the same time, consider this: if that nurse is your mother, brother, father, or sister who's being exposed to this, who's being expected to do everything that there are things which they are not even responsible for. If you go to the clinic right now and there's a shortage of medication, the patient is going to say that the nurses don't want to give me medication. And yet the nurse is not the one who orders the medication from the pharmacy. There's a pharmacist who's responsible for that. If they get to the clinic and the clinic is dirty, then the people are going to say that the nurses are not, they're treating us in a dirty clinic, So we need to come to a point where we prioritize and identify what is it within the healthcare system that is the responsibility of the nurse, and then everybody must be held to account for their part within this. And there are certain things which happen which are administrative bungles or the shortfalls within the administrative system, particularly in the Department of Health in Gauteng, which nurses are being held to account for. So we need to be able to correct that, where if nurses are to be held to account, let them be held to account for the things that they should be doing, which they are failing to do. But if they are doing their job and other people are failing in doing their job, particularly management, then we should not be holding it on to the nurses.
In the fight to adjust the salaries of public servants, where are you standing in terms of your attitude around it? And, are you giving up, or is this something that you will continue to pursue?
Well, on that one, our members have given us a clear mandate to say that they need us to go to the street, and we have declared a deadlock with the employer. And I know that according to the council regulations, there is a conciliation that has been scheduled, or that is still going to be scheduled. Then our national leadership is dealing with that matter. But we are in full support of our members to say that they are not satisfied with the current offer on the table by the employer, and the employer must try and do more to bring something to the table. These are the people who have been hailed as heroes, that they worked throughout COVID. But when it comes time that they must receive their dues, the employer is backing out now, saying that there's no money that the people should receive their dues.
Before we let you go, Mr. Mazibuko, in the erratic water supply that you're noting with concern around hospitals and clinics, what sort of support is being given to try and avert this, or intervention to ensure that there is indeed alternative water and that nurses don't have to carry buckets?
The support that has been given is not adequate. We've heard that there are tankers that have been sent to the hospitals, but if you know the hospitals, they are multi-story institutions, and there is not enough pressure for the water to reach the higher levels or the higher floors in the institutions. So therefore, nurses and cleaners still have to carry buckets to get the water upstairs, and patients are then forced to walk from the higher floors to the lower floors where they can be able to relieve themselves. And I heard that, I think yesterday at Helen, there was when the water came back, there was such an influx that the feces from the pipes were actually had soiled the wards in some of the places. So you don't want to experience that, because it means that patients are then exposed to the stench and all of those things which are not sanitary. And we're expecting better for the people of Gauteng when they're accessing healthcare services in this province.
Very well. Thank you so much for your time. Bongani Mazibuko, Gauteng Provincial Secretary for Nursing Union Denosa, speaking about the erratic water supply in the city, saying that it could lead to an outbreak of infections for both staff and patients.